radio for Boise and beyond.
Good afternoon and welcome to Vital Idaho here on KRBX Radio Boise, where we focus on issues and news of interest of folks here in the Treasure Valley. I'm your host, Beth Markley. For our show today, I thought I just would turn to an issue that I have an interest in, given some of the news coming out at the federal level from our Health and Human Services Secretary about immunizations, about whether or not the COVID vaccine is safe for children, and the immunization rates in Idaho, given the recent outbreak of measles. We've had 3 separate infections, measles, in different parts of the state. So my guest today, I recorded earlier this week, Heather Gagliano. She's the Operations and Education Director, and she's a registered nurse with the Idaho Immunization Coalition. And she joined me to talk about the state of immunization rates in Idaho and what's driving this trend, and a little bit about the work of the Idaho Immunization Coalition.
This is Mac DeMarco. You're tuned in to KRBX 89.9 FM, Coldwell, Boise area. We got a triple shot of Halen coming down the tubes for you.
Era uma vez o sol e a lua se refletindo no céu e no mar. A velha terra entrou numa fria. Falta energia de...
That was not what I meant to play. Here's my interview with Heather Gagliano. Heather, thank you so much for joining me today on Vital Idaho.
Thank you so much for having me.
So we have had some high-profile things going on in the news that I wanted to chat with you about with regard to Idaho's immunization rates and some things that are going on. But first, tell me a little bit about the Idaho Immunization Coalition. How do you do your work, and what is it that you're trying to accomplish?
Well, thank you so much again, Beth, for having me on. I'm so excited to tell you and all your listeners about the Idaho Immunization Coalition. So the Idaho Immunization Coalition, or I'll call it IIC, is a nonprofit in Idaho, and we work across the entire state. We are a coalition, so we're a group of individuals, community members, experts who are committed to sharing the science-backed facts about vaccines. So, we make up not only individuals who work for IIC, but we have people who are just really passionate about vaccinations, whether they're a pediatrician or a mom or just a concerned community member. They want to let Idahoans know about how important vaccines are. Our organization here does a lot of work throughout the state, but I like to really narrow it down to our big 3 pillars. We do a lot of vaccine education, whether that's to healthcare providers, to the public. We also do advocacy, educating people about policies that might impact vaccine access. And we also do public outreach and collaboration, maybe doing a health fair that includes information about blood pressure screening or glucose, and really partnering with other organizations to help support the health of Idahoans.
Fabulous. Why is this important? Why is this work important right now? I'm thinking about some of the Idaho has had at least 3 cases of measles pop up, and I want to maybe touch on that and how, whether that's extraordinary or not, or concerning, and why, and maybe the context of why it's important that you're doing the work that you're doing.
Well, I feel so my background's in nursing, and one of the things that I love about nursing was really looking at a person as a whole. And what can we do to really prevent diseases or illness? And vaccines are one of the easiest things that we can do to prevent illness in our community. You get an immunization, and it really reduces your risk of getting severely ill, needing to be hospitalized, having long-term complications. That's really particularly important in Idaho right now. Like you said, we have, unfortunately, as of today, 3 cases of measles in children and Idaho itself. And unfortunately, that is a highly contagious disease, and it is also a preventable disease. There is a vaccination for measles, and it is highly effective. Really effective vaccines to help prevent people from getting that. Idaho right now is seeing a decrease in our immunization rates over the past, so many years, and, looking at different data points, but big decreases in 10 years, and our exemption rates are going up. One of the things that,
go ahead. I didn't want to interrupt you.
No, it's just one of the things that it's important to know about immunizations is we have to have high immunization rates to be able to keep the vaccine preventable diseases from spreading in our community. So,
what do we know about Idaho in terms of how we rank across the United States?
There's a variety of ways to look at it. So I made sure that I pulled up kind of some of those up-to-date information for you. So one of the ways that we look at it is like for children who are born, how many kids who are 2 years old have received or up to date on their MMR vaccine. And nationally, we're looking at children who were born in 2021, 90.6% of them have received an MMR vaccine. In Idaho, that's 88.7%. And those for children born in 2021. And that's for their first dose of vaccination. We can also look at our school exemption rates. So how many kids are going to school in Idaho and are exempting from either providing immunization records or actually having an immunization. So for this past 2024 school, nationally, about 3.6% of students exempted from getting immunizations for whether that's religious, philosophical, or medical reasons. Idaho, for that same year, 2024, 2025, it's 15.4% of our kindergartners exempted from vaccines. So that's significantly higher.
Mm-hmm. And you said, forgive me if I overlooked this, but you said there's a significant portion of the population that needs to be vaccinated for everybody to be safe. Is that the case?
Yeah, that's correct. So it really depends on each vaccine preventable disease because each one has different transmissions, right? Some are more transmissible than others. For measles, we need above that 94% of our population to be able to be who are immunized or have some sort of immune protection for it to not spread within our community. As that vaccination rate or that protection rate goes down, it leaves bigger pockets for it to spread. And that's really because measles is so contagious. The disease itself, it can linger within the air or within a room for up to 2 hours after someone who has measles exits the room. I saw really great information put out from the National Foundation for Infectious Diseases that talked about, let's say 10 people were exposed to measles and they are immune naive. So they haven't had a vaccine and they haven't had measles before. So those 10 people were exposed. 9 of those people would get measles. So like I said, highly contagious.
And for some people, it may not be a big concern, right? But for others, it can be very dangerous.
I have a hard time saying for some people it's not a concern and for others it's not, because it's playing a little bit of a roulette and playing a gambling game.
Mm-hmm.
So measles does have certain population that it is more likely to have long-term complications or severe complications, but everyone's at risk of getting sick. And depending on how that person is, if they're immune compromised, they're more likely to get sick and have severe complications, whether that's pneumonia. For some children, they might have issues with encephalitis, pregnancy complications. And for some people, it might be minor where they have a high fever, they might have some ear infections or diarrhea. But it's that really young population you're really concerned about. There's most of the kids right now in the outbreak are unfortunately a disproportion of them are being sick are those under the age of 5 and they're being hospitalized. I think it's about 21% right now of the children who are getting sick are being hospitalized because of measles.
Mm-hmm. Well, and given what you said about the contagion rate, how contagious it is, that 21% could be a lot of kiddos. I'm also I don't mean to harp on the measles thing, but it just feels like it's kind of an indicative conversation of what's going on, and which I want to talk to you about in a minute. But so each of these cases, it feels like they've come in different parts of the state, so they're not necessarily related to each other. And I'm just guessing at that. Do we know, like, maybe where they've been infected and whether they've contained that, contagion itself, or as if they've exposed other children?
Yeah, it's a great question. So when it comes to the 3 cases that we know of right now is, from my understanding, none of them are related, so that they didn't come in contact with one another. We also knew prior to that first case coming out that there was wastewater detection up in northern Idaho, indicating that measles was going out of the wastewater. So what we can tell from them being not connected, from having that wastewater detection, is that there's probably more people out there with measles than the ones that have necessarily been reported, that we know of right now. Where they could come from, I know one of them specifically was someone was infected from someone who came in from traveling. And so we know that's kind of where that came from. And then they isolated. So that family is working to contain. The health department is working with them to be able to make sure if anyone came in contact that they're either up to date or are also isolating to make sure that they're not spreading those illnesses. But it hasn't been released as to like where exactly all the other 2 who got sick, where it came from. And, as you know, we're we like to travel a lot, right? People love to travel, and there's a lot of cases throughout the United States. So even though Idaho has only had 3 reported cases, you travel to some of those other areas with a lot more cases, there's a potential that maybe you came in contact through the airport or on some other, other places that you might go visit. Mm-hmm. We have a lot of cases up north in Canada. Our neighbor up north has quite a few cases up just in British Columbia, close to the border. And so if you go up there and you're visiting there might be some exposure there too.
What if you've been immunized? I remember actually this coming up when I was in college. There was some outbreak, and I know our university health clinic was just inundated by students who just demanded an immunization booster. Who should consider, if you've been vaccinated, getting a booster at this point?
It's a great question. So every child a year and older should at least have 1 vaccine, and then they get their second vaccine at 4 to 6 years old. So if you have children that are a year and older, you need to make sure that they're vaccinated, whether that's 1 or 2 doses, depending on their age. Adults also need a vaccine. So if you're unsure of your vaccine status, you might need 1 or 2 immunizations. That really depends on your risk for exposure and talking to your healthcare provider. There are people who should not receive the vaccine. So if an individual is pregnant, they shouldn't receive the MMR vaccine. Some people who are immune compromised cannot receive the vaccine. And for adults who are 68 years of age or older, they likely were exposed to it in their younger childhood years. So they tend not to necessarily have to get that booster. If you're unsure and you had been vaccinated and you happen to get an additional booster because you lost your vaccine records or you're just not sure, it's not harmful to get it again. It just will boost your immune system. The best thing to do is to talk to someone's healthcare provider or their pharmacist to see if they need it.
Okay. So what does this tell us about, or what are you hearing when you talk to people about immunizing their children? I know there's a lot of conversation going on, and maybe a lot of it's driven by the current administration and the, MAHA movement, perhaps. And what are you hearing from people, and including myths and maybe privilege? Like, we've lived for so long without some of these deadly diseases being a major concern, about maybe complacency. What's driving this decrease in immunization?
That is a $1 million question right there, is what is driving the decrease in people immunizing or having those questions. I've been in immunizations in this area for many years and pretty much my whole nursing career. Some of the same concerns people have had kind of continue to pop up from year to year, and you're able to answer those questions. One of the things I love about the Idaho Immunization Coalition is we do listening sessions where we actually go out in the community and listen to people and say, what are your questions? What are your concerns? And then we're able to target the information targeting that. I like to not talk about necessarily the myths because then sometimes that gets cemented in our heads. But I do like to talk about what I do know about vaccines, and vaccine preventable diseases. And I love to let people know vaccine preventable diseases have not gone away. We had so many cases in the Treasure Valley and throughout Idaho of pertussis last year that was really impacting our elementary school age children and older adults. Unfortunately, we had someone pass away in Idaho last year with pertussis. I've talked to people about how vaccines are safe, how they're effective, and how they are thoroughly studied. And they're studied not only before they go out onto market and before they're licensed, but they're studied after that too. And our immunization schedule is updated yearly because those different studies and reports are coming out to make sure that vaccines are safe and effective and we're giving it to the right people at the right age. And those are constantly being reviewed. And as we get additional information and more information, we're able to adjust it.
Interesting. So when you're talking to people, are they driven maybe, is this hesitancy maybe driven by some of these myths is it possible that some of them are just feeling like it's just an unnecessary step at this point, because we haven't necessarily grown up under the scourge of some of these diseases that vaccines today take care of?
There's a variety of drivers that people talk about. Some of it is misinformation. And so people feel like that they have accurate information, which unfortunately it might be actually misinformation or misquoted. You have some people who, you're a parent who's working and you have young kids and it's just getting a vaccine is not on the top of your mind. You have to worry about dinner, homework, and getting off to soccer practice. Although for me, it's always top of mind and a huge priority. That's not the reality for most people. And so it becomes a little bit, like you said, I don't know if complacency, but it's just competing priorities. And again, if you don't have a lot of people sick and you might not be noticing it, it's gonna fall down on that priority list.
Sure.
For other individuals, it is actually barriers to getting vaccines. So, if you're working full time and you might not be able to get your child into an office, from that 8 to 5 Monday through Friday timeframe, it gets a little bit more difficult. For adults, I hear adults who want to get vaccinated, but unfortunately the cost of vaccines is prohibitive for them to be able to get it, especially if they have insurance that might not cover that.
So what kind of resources are available for folks who are experiencing some of these barriers, whether it's time or expense or access? And what are some of, I mean, I know you have events and fairs and things. What are some of the things that you're doing to make sure that people have improved access?
Yeah, so that's one of the things that's wonderful about the IIC is we work to overcome any of those barriers. First of all, we support everyone. Everyone has the ability to make that choice. So if you choose to get vaccinated, we try and make that an easy choice. So having events or health fairs on the weekends, in the evenings, having other things just in one place. So if someone needs to get a mammogram and they need to happen to get their flu vaccine, you kind of combine it all together so it's one-stop shopping. I know a lot of other organizations are trying to make it easy, such as like going to a pharmacy and being able to walk in. Some of medical providers try and make it easy where you don't have to see like the physician, but you can go and make a nurse appointment to be able to go in and see the doctor. When it comes to, I feel like the misinformation, our organization tries hard to educate people through webinars, where at different events where we have healthcare providers, whether that's a nurse or a pharmacist. We've had physicians participate where they're able to take those one-on-one conversations with people, truly listen to their questions and their concerns, and be able to provide them with some really great fact-based information for them to consider as they weigh those at that decision whether or not to vaccinate.
Interesting. You talked a little bit about pertussis, and we talked about measles. I know flu season is coming up. What do we know about the flu vaccine and when people should get it and who should get it?
That is wonderful timing. I even like to call it respiratory illness season because not only flu, but we also have RSV, along with a myriad of other respiratory illnesses that we don't have a vaccine for. So when it comes specifically to the flu vaccine, everyone 6 months and up should receive at least one dose. And if they're a little bit younger, sometimes they receive 2 doses of the influenza vaccine just to help boost their immune system.
Annually, right?
Annually. So it's once a year, 6 months and up. And, you know, really, because of the flu vaccine, you want to make sure that when you get it, you have it last for as long as you can throughout the flu season. And you can't predict with a crystal ball if it's going to be an early flu season or a late flu season. Oftentimes it's recommended someone get it before the end of October. Again, I can't say this for every single person, they need to talk to their individual healthcare provider, but my goal is always to get my family vaccinated before the end of October. Before they're trick-or-treating, they're protected. It's important to remember that the vaccine takes up to 2 weeks to actually build up that full immunity. So if you have a trip coming up, maybe you plan that, I'm going to be on an airplane. I'm going to do that a couple weeks beforehand during that season so that you're fully protected. RSV vaccine is one that a little bit older adults are going to get, or those young babies, or sometimes moms who are pregnant are able to get that vaccine to protect them from RSV during this coming season.
Is RSV, and I've heard about the pneumonia vaccine, and actually I'm in that demographic where they're starting to recommend it. Is that something that's easily accessible as well?
RSV, so that's a vaccine that for older adults you can get at a pharmacy and is oftentimes over there. For women who are pregnant, they're going to be talking to their OBGYN and getting it at certain points throughout their pregnancy. And infants are going to be maybe getting that at the hospital or at their pediatrician office. So if someone's interested, go to a pharmacy, go to your provider's office and talk to them about if they have it available or where they can get it.
I hear a lot of folks who have some hesitancy or have some anxiety about vaccine, talking about doing research. What are your primary resources for sites that people can trust for really good, easy to digest information about what they should be doing for themselves and for their children?
I love the point where you talk about easy to digest because, when you talk about infectious diseases and you talk about medical interventions, it is a language of its own. So one of my favorite places to go to is the National Foundation for Infectious Diseases. I think they provide some really great information about not only infectious diseases, but immunizations, and just talk about basics of hand washing, which is a simple thing to do to help reduce illness. You can always go to the CDC and get information about the most up-to-date vaccine schedule from there, and they have some parent resources. Another one, if people really love to dive in, is the Vaccine Integrity Project. They have good information about immunizations. They recently had a webinar that they had where they were looking at different respiratory diseases and actually talked through the process of how they looked at different studies to include in that presentation. And it was really in a way that I think anyone could understand and digest. It was a great presentation on that one. And then the American Academy of Pediatrics has fabulous information about vaccinations specifically for kids.
Great resources, all of those. Well, thank you so much. Heather Gagliano, I really appreciate your talking with us. Heather Gagliano with the Idaho Immunization Coalition.
Thank you so much, Beth. I appreciate you having me.
And thanks to all of you for joining us today here in Vital Idaho for another new show. We've got folks from the Big Tent waiting to come in and share their thoughts and perspectives with you. So stick around and have a great rest of your week. It's almost the weekend.
This is a new song. It's called Mercy Me. Piece it out in parts, babe. Tell me where it goes. Come and use your fingers to keep me on my toes. Say it in a whisper, play it like a scream over and over till I wake up from this dream. Give me just a minute to understand the power that I feel ignite within me when I've held you for an hour. Come and pause the pacing of the stars that I can't name over and over, but it never